Today, let's talk about beta blocker therapy in heart failure with preserved ejection fraction, a systematic review and meta analysis. While beta blockers are considered the cornerstone of treatment for heart failure with reduced ejection fraction, the same may not apply to patients with heart failure with preserved ejection fraction. To date, the benefit of beta blockers remains uncertain and there is no current consensus on their effectiveness. This study sought to evaluate the efficacy of beta blockers on mortality and rehospitalization among patients with heart failure with preserved ejection fraction. Coming to the method, a systematic review and meta analysis of randomized or observational cohort studies examined the efficacy of beta blocker therapy in comparison with placebo, control, or standard medical care in patients with heart failure with preserved ejection fraction, defined as left ventricular ejection fraction greater than or equal to 50%. The main endpoints were mortality, rehospitalization, and a composite of the two. Coming to the results, out of the 13,189 records initially identified, 16 full text records met the inclusion criteria and were analyzed, recruiting a total of 27,188 patients. The mean age range was 62 to 84 years old, predominantly female, with heart failure with preserved ejection fraction, in which 63.4% patients received a beta blocker and 36.6% did not. The pooled analysis of included cohort studies of variable follow-up durations showed a significant reduction in all-cause mortality by 19%, whereas rehospitalization for heart failure or its composite with all-cause mortality was similar between the beta blocker and control groups. To conclude, this meta-analysis showed that beta blocker has the potential to reduce all-cause mortality in patients with heart failure with preserved ejection fraction based on observational studies. Nevertheless, rehospitalization for heart failure or its composite with all-cause mortality, large-scale randomized trials are needed to clarify this uncertainty.